Welcome back to another educational installment of Medicare. My name's Stefan DiLorenzo, and I'm joined once again by today a local insurance agent, Mr. Holly Roberts. Thanks for joining us today, Holly.
Well, you're welcome. I'm glad to be here.
Right. Why don't you tell our viewers a little bit more about what yourself and what we have in store for today?
Okay. Well, thank you, Stefan. Yeah, I'm Holly Roberts. I'm a local insurance agent here in Madison, Indiana, and my sole focus is helping those of you who are on Medicare. I've been licensed since 1982, and I'm licensed in Indiana and in Kentucky. And I've been certified through all the companies that Medicare requires me to be certified with, and so now I'm able to discuss Medicare with people and also help them with their Medicare insurance needs. And so, Stefan, on today's program, I think we're going to do what we did on our last episode, and that's have some questions and answers. Some more good questions have been sent in, and so we'll just do like we did last time. You read the questions, and then I'll give the answers. And these are really good questions because these questions deal with topics that affect almost everyone who's on Medicare. So I think this will be helpful for our viewers today.
Yeah, I'm sure it will be, and let's get started. I've got the first question right here.
Okay.
Okay. If I'm admitted to the hospital, is the $1,216 Part A deductible all I'll have to pay?
That is a great question. And the short answer is no. Part A of Medicare covers essentially everything except physician's fees. The important expenses that are not covered by Part A are the doctor's fees, and there could be a lot of doctor's fees because, you know, while you're admitted in the hospital, you could be seen by the surgeon, anesthesiologist, intensive care doctors, your primary care doctor that comes to check on you while you're in there. So this could become very costly, and those doctor visits would be covered under the Part B of Medicare. So that's why it's very important to have both Parts A and B. Remember, Part B covers doctor's fees in the hospital or out of the hospital. So if you're admitted into the hospital, you will have more than your Part A deductible to pay. And by the way, in 2015, starting in January, that deductible is going up from $1,216 to $1,260. So this is the reason why I think it's very important that you consider having a Medicare supplement, because without a supplement you could be responsible for a lot of money that could be paid out of your pocket. Medicare is great and it covers the vast majority of the costs. But it's still, if that's all you have is Medicare, it could leave you paying a large amount of money out of your pocket. So please consider at least having a Medicare supplement to go along with it. That was a great question. Okay. I'm glad you started with that one.
Yeah, that's great information, and that kind of leads into our next question, which naturally follows. Let me read that one now here.
Okay.
It says, I was in the hospital for about 2 days. My nurse told me that my stay in the hospital was to be considered an observation stay, and that Medicare would pay for me for my stay differently than an inpatient hospital stay. Right. Can you explain this to me, and exactly what is an observation stay?
Yes, and you know, this happens quite more frequently than you might think. So it's another good question, and I'm glad someone asked this one too. Basically, an observation stay is an outpatient hospital stay. During this stay, you still receive medical services that help the doctor determine whether to admit you or to release you, but in the meantime, you're still in the hospital. For example, an observation stay most often happens when you first go in to the emergency room, and a doctor then has to monitor your symptoms and so that he can decide whether or not you should be admitted or discharged. So this is important. You are an outpatient until you are admitted into the hospital. Even if you stay into the hospital overnight, an observation stay may seem like you're actually inpatient in the hospital, but just because you stayed there overnight doesn't mean that you are an actual inpatient. So here's the key. You're only considered an inpatient if you have been formally admitted into the hospital by the doctor. If you have not been formally admitted, then you are considered an outpatient, okay? So if you are in the hospital, here's what I really recommend. That you or a family member discuss this with the staff as to whether you're an inpatient or outpatient each day that you're in the hospital, because this can affect what you pay. Remember, Part B of Medicare is what pays for outpatient care. So it's Medicare Part B that will be paying for you to be in the hospital even though it's an observation stay. And this means that you would actually end up being charged or paying 20% of the charges, because remember, Part B is a 80-20. Medicare pays 80 and you pay 20. So if you're an outpatient in the hospital, that could really add up. So you or your supplement, if you have one, would be responsible for that, paying that 20%. Now, if you get your Medicare benefits through a Medicare Advantage plan, different costs and different rules apply to that. So you need to really contact that plan directly to learn about those coverages and the hospital care and the network and all that stuff. So I know that's a long answer, but it's important to know so that you won't be caught by surprise. And you know, it almost seems like there are more observation stays now than there used to be. So that was a great question. Thank you.
What valuable advice. I mean, really.
Yeah.
This next question is one that comes out a lot during this time of year because it concerns the flu shot. Right. And here's the question I've got.
Okay.
I want to get my seasonal flu shot, but I'm afraid that Medicare won't cover it. Does Medicare cover the flu shot?
Well, that is a good question, and the answer is yes. Medicare Part B covers a flu shot once every flu season, which typically runs from November to April. And here's more good news, okay? Medicare considers the flu shot to be a preventative service. This means that you will not have to meet your deductible and you will not be charged anything for the shot if you use a provider, whether it's a doctor or a pharmacy. A lot of pharmacies give those shots now. Mm-hmm. Just as long as they accept Medicare and take assignment, okay? So if you have a Medicare Advantage plan, though, your plan should also cover the entire cost of the flu shot as long as you follow the plan's rules and stay in their network. So bottom line is this: yes, Medicare does cover the flu shot and will pay for it. Just make sure you have it done wherever they take Medicare and accept assignment. So yes.
That's great. That's great. I have a question for you from what you're talking about here. You keep using this term, takes assignment.
Right.
What does that mean exactly?
Well, okay. If a doctor or a hospital or even a pharmacy takes assignment, that means that they accept the Medicare approved amount for that service as payment in full. And as a result, they cannot charge you more than what Medicare has allowed. Okay, so that's what I mean by that assignment, taking assignment.
Yeah, I understand that now. Thanks for clarifying that. Okay, here's another question, and it seems like a question that many folks have, and here it is.
Okay.
I have original Medicare. Does Medicare cover routine dental care, such as cleanings and checkups?
Well, that's a good question too. The answer is, unfortunately, no. Medicare does not cover routine dental care such as your cleanings and your exams. And it doesn't cover things like fillings and root canals, crowns, and even dentures. So if all you have is original Medicare and you want insurance coverage for dental care, you'll need to obtain a separate dental insurance plan. However, if you have a Medicare Advantage plan, you might have some limited coverage for some dental care. It all depends on that plan's specific benefits. So if you have a Medicare Advantage plan, again, my advice to you is to contact that plan directly to see which benefits they offer and are covered by that plan. So, but the bottom line is, generally, Medicare does not cover dental.
Okay. All right, Holly, this next question is very similar to the last one, except it asks about vision coverage.
Okay.
It says, I wear glasses and need to get my eyes checked every year. I'm about to become eligible for Medicare. Does Medicare cover routine eye care?
Well, that is another great question. And in most cases, Medicare will not pay for your routine eye care. However, though, this is important. Medicare can and does make exceptions and will pay for routine eye care in the following situations. If you have diabetes, Medicare will help pay for an exam once every 12 months to check for eye disease that can be a result of you having diabetes. Another time is if you are at high risk for glaucoma. Medicare helps to pay for an eye exam by a state-authorized eye doctor once every 12 months. And finally, they can also pay for eye care services that if you have an eye condition such as cataracts or glaucoma. Not just if you're at high risk for glaucoma, but if you actually have the glaucoma or cataracts. And Medicare even pays for someone to have cataract surgery. But listen, keep in mind though, that Medicare does not cover for eyeglasses or contact lenses unless you have had cataract surgery, and they'll pay for one pair of glasses or one set of contact lenses right after you've had your surgery. Now again, here's the same advice. If you get your Medicare benefits through a Medicare Advantage plan, contact that plan directly to learn more about their rules, their costs, and their benefits. And it could be that your Medicare Advantage plan does have coverage for routine eye care. Some do. So just contact them and ask them, okay? That's my best advice for Medicare Advantage.
Yeah, well, we're about out of time, but I want to include this last question here because it affects everyone who has Medicare, and that's why I picked this one specifically here.
All right.
It says, I heard that Medicare covers preventative care services such as the Welcome to Medicare visit and annual wellness visits. What is the difference between the Welcome to Medicare visit and the annual wellness visits?
Well, that is a great question to end on, and I'm glad you did choose that question. The Welcome to Medicare visit is a one-time visit that maps out your health care needs and helps to create a preventative plan between you and your doctor so that to help keep you healthy. Medicare covers a Welcome to Medicare visit as long as it takes place during the first 12 months that you have Medicare Part B. Now, if you missed your chance at receiving that Welcome to Medicare visit, in other words, maybe more than 12 months has gone by since you enrolled into Part B, you can use your annual wellness visit to create this preventative health care plan. So let me explain the annual wellness visit, okay? This visit is a yearly visit with your doctor that discusses your plan of preventative care for the coming year. And again, this will either create a plan or update your plan based on your health care needs. Medicare covers the annual wellness visit once every 12 months. And here's the good news. Medicare covers both the Welcome to Medicare visit and the annual wellness visits at no charge, as long though as you go to a healthcare provider that accepts Medicare and takes assignment. But this is important. These visits are not routine head-to-toe kind of physical exams, okay? Instead, they are visits which are designed for you just to have a conference with your doctor to update or create a preventative care plan for you to keep your health in good shape. And this is important because this happens quite often. Costs may apply if you receive additional tests or services in addition, okay, to your health visit with your doctor. For example, let's say you go to your doctor for your annual wellness visit and your doctor finds out during that visit that you have dangerously high blood pressure. And maybe during that visit, you've told your doctor, hey, I've kind of been feeling a little dizzy too. Well, the doctor probably won't just let that go. So he may order additional tests and treatment like a blood work or something, okay? So if you have other treatment, there'll be a charge for that. There'll be no cost to you for the doctor consultation, but there will be a charge for blood work, tests, other tests, okay? So be prepared for that, and that would fall under your Part B, okay? Now, one more thing. Again, if you get your Medicare benefits through a Medicare Advantage plan, you still will pay nothing for your Welcome to Medicare visit or your annual wellness visits as long as you see doctors that are in their network, okay? So you'll need to contact your plan directly to see their rules and to make sure your physician is in their network. So I just want you to, Medicare Advantage plans, it's almost always wise to contact them to make sure things are covered. So, and these have been great questions you've chosen, and I hope that this has been helpful to our listeners and our viewers. So.
Yeah, I'm sure it has, and I wish we could keep going, but our time's running out.
I know.
I'm so glad we're able to provide this information to help our viewers, and I want to remind you that if you've missed any of the previous episodes, you can find them on our website at wkmnews.com. So go online, you'll find them under the Public Service Announcements tab at the top of our page. Holly, how can viewers contact you if they have any questions or if they need help getting Medicare insurance?
Well, the best way to contact me is just to give me a call. You can call me here. My phone number is 812-273-4191. Again, I'm licensed both in Indiana and in Kentucky. And I need to take this last minute to remind you that Medicare's open enrollment is taking place as we speak. And it goes until December the 7th. So if you need to make changes for 2015, now's the time to do it. Okay?
Yeah. Well, thanks for watching this episode. That wraps it up. Thank you for tuning in, everybody. Until next time, I'm Stephan DiLorenzo.
And I'm Holly Roberts. Thank you.
Thanks.